Welcome to Desert Living, where we connect you with everything that makes the Coachella Valley a wonderful place to live. Desert Living starts now. Here's Brian Gallo.
Happy Thursday, everyone. Thanks for joining us. A beautiful day today and a beautiful show here at Desert Living. I've got a great lineup today. In fact, we're going to start with Mr. Shahin Etebar, doctor, I should say. How are you?
Good morning, Brian. It's good to be here.
Yeah, I'm happy to have you. Welcome.
Thank you.
This is we tend to focus on lots of relevant topics here on the show. This one is very relevant to me. I'm 6'3" and I've had back problems my whole adult life. So let's jump right in. What are typical causes of back pain?
Well, spine is a very complex organ. Everybody thinks that your back hurts and that's the only thing. But for example, the lower back, the lumbar spine, is made of five separate segments, discs, 10 joints. There are multiple ligaments and muscles that all insert in that area. And any of them could potentially lead to pain. So it's really important to recognize what the anatomy is before you start treating the problem.
So how would one find the origin of the pain?
Okay, that is actually the most difficult thing that we do.
I would imagine, yeah.
As a spine surgeon, it is really like playing a detective.
Okay.
When a patient comes in, they just say, well, my back hurts. Now, you have to go through a complete history, find out how the injury started, how the pain started, what makes the pain better, what makes the pain worse. And sometimes people feel that these are mundane questions, but 90% of our diagnosis actually comes from the history that we get from the patients. So it's really important to be very specific as far as what are you feeling, where the pain is, how is it traveling, is it radiating down the leg, and what have you. The origin of the pain can be very complex, could be any of the discs, could be any of the joints. You could have pain from the hip that radiates to the back. You can have intra-abdominal problems, like an aneurysm, for instance, that could radiate pain to the back, or even kidney stones. So it is challenging to figure out exactly where the problem is, but until you know where the pain is coming from, you cannot treat it effectively.
So potentially a list of a mile long of things that could. Okay. So what about, where do X-rays come into place? How do you diagnose?
So once we go through a detailed history with the patients, then we do a detailed physical examination that gives us additional information as to where to hone on, and then based on what we get at that point, we decide what tests are necessary next.
Okay.
X-rays are really good in terms of looking at the bone anatomy. We frequently get X-rays with patients laying down or upright because the gravity changes the anatomy of the spine. Okay. When you lay down, a lot of times you feel better. When you're upright, you hurt. Okay. So we want to know what happens and what is gravity doing to the spine. MRI is excellent for looking at the nerves, the nervous structures and the details of that we don't get with any other study. We do use CAT scans. Okay. And some certain tests that involve injection of nuclear dye into the body, and that goes to the areas of the stress in the spine. So, so we use that frequently.
Tell me about treatment, because that's obviously very important. Give me some insight on treatment.
All right. So once we have successfully determined where the pain comes from, then we can decide on treatment. Typically, we start with the minimal, non-invasive type of treatment, and then we escalate from there. 90% of people with back problem get better without any intervention.
Really? 90%?
90% of people.
Let me ask you this, because this is obviously important. Surgery, how often is surgery coming into factor?
In my practice, actually, surgery is less than 5 to 10% of the time.
And what kind of surgeries do you do?
We do spine surgeries of the whole gamut, from the minimally invasive to scoliosis and deformity correction. Okay. So we do the whole gamut.
Let's find out exactly how to find you. You can find Dr. Shahin Etebar at 1180 North Indian Canyon Drive in Palm Springs, 92262. Give him a call at 760-346-8058 or dretebar.com. Appreciate you being here, Doc.
Thank you very much.
Yeah, I need to go stretch real quick, get my back ready. I got more show for you in just a minute.